After over a decade of treating patients with spinal stenosis, this is the treatment path I would follow for myself if I were faced with it. Okay, real quick. Every case of spinal stenosis is different. So, this is not medical advice. This is the path of treatment I would attempt to follow if I had spinal stenosis, but obviously consult with your healthcare professional. Okay, number one, I would get an MRI to confirm that my spinal cord was not at risk of severe damage. There are rare cases where the spinal stenosis is so severe that there's risk of spinal cord injury and paralysis of the legs. So, first thing I would do is get an MRI and confirm that this is not a concern. Number two, I would confirm that there are no red flags. These include a history of trauma, like a car accident or a fall, any bowel or bladder changes, any history of cancer, any unexplained weight loss, any fever, persistent pain throughout the night, saddle anesthesia, which is numbness in the groin region, and also if there's no improvement with any movement, if you can't find positions that decrease the pain, and if you can't find positions that increase the pain, then that's another red flag. So I would confirm that there's no red flags. That's step number two. Number three, I would modify my activities to minimize pain. I would take steps to learn what my pain triggers are, learn which movements are aggravating my symptoms, and then I would find ways to do my daily activities while minimizing those pain triggers. I would also modify the way I walk. I would uh, take rest breaks when I walk, and I would make sure to take those rest breaks before those symptoms in the legs really begin, because once those symptoms kick in, it really can set you back for the rest of the day. So I would take shorter walks. I would take rest breaks to sit down. And in doing so, I would actually be able to accumulate more activity throughout the day. So, step number three, I would modify my activities. Number four, lifestyle modifications. While none of these are actual causes of spinal stenosis, they could contribute to your symptoms once you have spinal stenosis. So, if weight loss was an option, I would do that. If I were a smoker, I would quit smoking. I would reduce my alcohol consumption. I would take steps to manage my stress. And also, I would improve my nutrition. So, each of those can be really broken down and, and gone into in detail. But big picture, I would make lifestyle changes to optimize my health and try to manage this condition. Number five, I would implement an exercise program. I would start this with either a walking program or stationary bike, um, in conjunction with strength training, resistance training. So I would try to do that on my own. If for some reason that poses a problem, then I would pursue physical therapy. So I would find a physical therapist who specializes in spinal conditions such as spinal stenosis. I would attempt physical therapy, see how that goes. If traditional physical therapy didn't work or if it caused more pain, then I would try water therapy, basically exercising in the water. It's a really nice way to decompress your spine, and it allows you to do exercise and strength training that you might not be able to do otherwise. So, exercise, physical therapy, that would be my next step. Number six, traction therapy or decompression therapy. You can do this in a physical therapy clinic or a chiropractic clinic. It's a passive treatment that decompresses your spine, takes pressure off the nerves or the nerve roots. I would do this in conjunction with exercise. In my opinion, there's not much sense in doing it if you're not going to exercise, because it can provide some short term relief by decompressing those nerves, but it's only temporary. And it might provide you a window of opportunity to do strengthening and core strengthening exercise. It gives you a nice window of opportunity to make those changes with how you move. So I would give that a try with exercise. Step number seven would be an epidural injection. There are different types of injections. I could make a whole video breaking down the various injections, but some sort of epidural steroid shot. This reduces the inflammation around the nerves. Once again, it gives you a window of opportunity to do rehab, to exercise, to strengthen. Again, it can provide short term relief, but if you're not going to exercise, then it's really just short term relief. So, step number seven, epidural injection with exercise. Step number eight, I would look at low dose pain medications. to try to improve my quality of life. I would be very careful here about keeping the dosages low, and I would also do everything possible to avoid opioids, just because that leads to so many other problems. But there is a point where I would try medications in conjunction with exercise and physical activity to try to improve my quality of life. So low dose, I would try a low dose and see if I can manage it that way. Okay, number 9 is surgery. This is the step that I am trying to avoid at all costs if possible. Unfortunately, there are cases where you have to have surgery or it just reaches a point where you have to have it. If I were to have surgery, I would go to a neurosurgeon or an orthopedic spine specialist. I would go to one at a large medical facility, preferably in a larger city, and I would want to have surgery one time, unless there was some sort of mistake made or something just didn't go according to plan with the surgery. I would not have surgery a second time. It just, in my experience, folks that end up having 2 or 3 or 4 surgeries, it just doesn't go well. So one surgery if possible. If there was some sort of mistake made that could be fixed in the surgery, I would go with a different surgeon for surgery number 2. But that's the only way I would do 2 surgeries. And of course, I would do exercise and rehab before the surgery and after the surgery. Otherwise, if you don't make modifications to how you move and if you don't continue to strengthen and improve your body, um, pain can come back after surgery. So definitely exercise again. And number 10 and final step, if surgery failed, I would try some sort of an intrathecal pain pump or a spinal cord stimulator. I would hope to not get to this point, but again, if surgery failed, if I had exhausted all 9 of the steps before, then some sort of a pain pump or spinal cord stimulator, that would be my 10th step, and I would still exercise. So, if possible, those are the 10 steps in order that I would follow if I had spinal stenosis. Obviously, no case of spinal stenosis is identical. There's different challenges along the way, and inevitably, adjustments would have to be made to my pretty little list of steps that I would follow. But I would try my best to follow those. It is absolutely worth it to take steps to try to maximize your quality of life. Spinal stenosis is a tough condition to manage, but you got to be active with it because otherwise, it just gets worse. So I would exhaust all those options, all reasonable options before surgery. And I hope that helps.